Okay, good morning. Anywhere where you watch us from, welcome to Health Matter, where we discuss everything we get to do with health and ilera, that is well-being. Not really health, we want make your well-being self dey okay. That is why we put this program for ground. Sharply, I want make you know, say we don't start one topic we say get to do with cancer awareness vis-a-vis breast. We say we don't dey talk since last week. Knowing full well, say last month, 7 they've been celebrating time. So Dr. Bade in the building to further expatiate on waiting we don't begin since last 2 weeks or thereabout. So good morning, everybody. Good morning, sir.
Yeah, good morning, Chief.
How is the hospital, sir?
We are doing great.
Well done, sir.
Slimmers,
Doctor,
good morning.
Good morning, sir.
Good to see you.
Same here, sir.
Yeah, thank you. We are doing great.
I think I would want us to start on this note. Yeah. Last week, I told Slimmy that I wouldn't want to use the word I was opportune to see because it's not a good sight. It's a gory one. But I saw somebody who was actually gasping for air, a neighbor, the high blood pressure. By the time we rushed the person to the hospital, they did a sugar test first. They punctured the hand. The sugar was okay. By the time they did the BP, it was 180, I think over 20 or thereabout. The question I want to ask, which I'm sorry I'm taking us back just for us to learn, though she gave up, but the question I want to ask is, when we say administer aspirin to somebody who actually is suffering from BP or stuff like that, what I saw is, as at that point, the woman could not or cannot swallow anything. In fact, as at the time we got to the hospital, some of the neighbors had already squeezed onions into her mouth. So the doctor needed somebody to first remove all the onions from the mouth before they can put a mouth gag in her mouth. I call it mouth gag. I'm sorry, I don't know what you people call it, but doctor, how possible is it to administer aspirin for somebody who is already in that state?
Thank you very much. But allow me to say good morning to our viewers at home and around the world. Okay, well, this morning, before I deal with his question, I'd like to introduce the topic of the day. We said last week when we ended the program on non-malignant breast condition that this morning we'll be looking at malignant breast conditions or breast cancer in a way everybody will understand. Okay, but in the course of the program, I'm going to answer the question that he started with. Okay, well, in order for us to be organized, okay, I want us to start with what we have for today, and which is breast cancer. We're going to talk to us about breast cancer because it's very common, just like the cardiovascular event that he just mentioned before we started is as common as well, okay? But we'll be looking at breast cancer under the following heading. We want to do an overview. What is cancer all about? Okay, we want to talk about epidemiology. We want to talk about anatomy of the breast as an organ or as a tissue of the body. We want to talk about breast-oriented medical history. We want to talk about the causes of cancer, if there are any, risk factors, the modifiable as well as the non-modifiable risk factors. We want to talk about signs and symptoms as well as types of breast cancer, as well as how to make a diagnosis of breast cancer vis-a-vis the staging of breast cancer. And then if time will allow us today, we could go as far as treatment modalities and, of course, prevention, prognosis, and then we'll make a conclusion. On that note, I'd like to say once again, good morning to our numerous viewers at home and around the world. My name is Dr. Bath Tochukwu Ufebunam. I'm the Medical Director of Grace Valley Medical Center. So we go. What is cancer? Now, I will try as much as possible not to use plenty of medical jargon so that everybody can understand, because cancer on its own has a lot of words that actually sound a bit unfamiliar, if I may use that word. Okay, so what is cancer all about? Now, every organ and tissue in our body are made up of cells. And we have over a trillion cells on these tissues and organs of the human body. These cells have gene that controls its action. It is the work of the gene to order what the cells should be doing individually at any particular time. If the order starts to divide, division will start taking place. Work. If the order is die off, of course, such a cell will die off. So they obey those set of commands that are predetermined by the genetic makeup of such a cell. Now, when these cells, sometimes these instructions could get mixed up. Okay? When that happens, the cells can start, can go out of control. Just imagine having a vehicle that suffered a brake failure and the driver has no grip, has no control of where the vehicle is headed again, or probably a vehicle that the steering must have pulled up. And of course, when the driver tries to turn the wheel, he discovers that he's not even controlling the tires. So that is the picture you have in cancer. Cells that have gone crazy, that have gone out of order, that have gone out of sync. They will keep dividing and they will not obey the stop order when they should stop. They will not die off when they should die off. And when you have that occurring, it could form an aggregate of abnormally and rapidly dividing cells that could form an aggregate that will give rise to tumor. Are all tumors cancerous? The answer is no. Some tumors can be benign, meaning that some tumors can be non-cancerous. They grow abnormally. They rapidly divide abnormally. But they stay located in a particular tissue or organ of the body. They don't usually go beyond that. So in a situation where you take out such a tumor, you have actually solved such a problem. So this set of tumors are called benign tumors. But some tumors too can be cancerous in the sense that they could go beyond the tissue of the body where they started or where it all began. And of course, I want to also tell us that we have over 200 types of cancers, different types of cancers. And usually, wherever the cancer starts, we have the part of the body attached to its name. So, if it starts from the prostate, it is called prostate cancer. And of course, when this cancer that started from the prostate travels beyond the prostate and probably gets into the lungs, it's still called prostate cancer with lung metastasis, meaning that it has traveled to the lungs, but then it started with the prostate. If it started from the breast, it is called breast cancer. And of course, that is our focus. And now, that is our focus for today. Now, before we go into all of that, I want to give an overview, a brief anatomy of the breast. Now, the breast is the tissue that is located on the ventral surface or on the thoracic surface of our body, the chest cavity. Usually, every human being should have two. The breast is made up of the nipple, the body of the breast, the substance of the breast. But within the breast are a number of structures that are very important that we should talk about them. In the substance of the breast, you have about 15 to 20 sections that are called lobes. These lobes are further subdivided into smaller sections that are called lobules. These lobules are interconnected to each other by a network of tubules that are called ducts. And of course, these ducts will aggregate together to form lactiferous duct and of course open on the substance or exit on the substance of the breast. Apart from the lobule, which of course is the milk-making aspect of the breast and the duct, the breast also has adipose tissue, fats, as well as supporting connective tissues, usually called the stroma. Also in the breast, you have numerous blood vessels that supply and as well as take away blood from the breast. It also has innervation, nerves that are responsible for the sensation that we usually feel when we are touched on the breast. Suffice to also mention, to say at this point, that one of the most important structure of the breast that we need to understand to have a clear view of how cancer metastasizes is what we refer to as the lymphatic system. Just like every other tissue and organ of the body, the lymphatic system does the work of cleaning an organ or a tissue. And this lymphatic system are made up of lymph nodes with a network of capillaries. They have lymph that they conduct with which it cleanses the body. All over the body, you have aggregates of lymph nodes that are usually located in those places. And of course, you may not even notice that they're actually in existence. But when you have an injury, for instance, when you have an injury on your leg, after some few days, you discover, if it is on the right leg, you discover that you have a lump. Yeah. Betere? If I'm correct, sir.
Betele.
Okay, yeah, thank you very much. In Igbo, I think we call it Mburujok or something. Okay, so you have a lump in that part of your body. Now, that lump is a lymph node that has been inflamed in the course of doing its work. So you have such lymph nodes scattered on the axilla, okay, or the armpit. When you discover that you have significant lymph node enlargement on any part of your body, it should be a cause for you to raise concern, for you to go and see your doctor. So these lymph nodes are usually the ones that does the cleaning of the organs of the body. It is through this network of lymphatics and lymph nodes that cancers usually will spread. If it started from the breast, it could spread to the bones, to the backbone, and to some other parts of the body. Also, the names of the cancers of the breast have something to do with the structure of the breast from which it originated or from which it originates from. For instance, if the cancer is taking root from the lobe, it is called lobular cancer. If it is from the duct, it is called ductal cancer. It could also be from the muscles and connective tissues of the breast. Now, what are the signs and symptoms of breast cancer? But before we go over to signs and symptoms of breast cancer, I'd like to talk about breast-oriented medical history. When a doctor has a patient who comes with complaints of breast pain, breast swelling, or breast lump, the doctor will need to ask a number of questions. For instance, the doctor will want to know the time such a patient started seeing her menses. If she's a woman, it's important. You also would like to know if that swelling is associated with any form of breast discharge. Some can occur without having to compress the nipple, but some can occur when you put a gentle pressure on your nipple as a woman. And of course, the characteristics of such a discharge can tell a lot of things about what could be going on inside. Is it a nipple? Is it a bloody-colored nipple discharge? If it has to do with that, you can be thinking of intraductal papilloma and some other breast conditions. Okay, so apart from now, what are the signs and symptoms that a layman can look out for? Number one, the shape of your breast. Are there changes in the shape of your breast? You need to take a look first. Are there color changes?
It goes darker.
Yes, in and around your breast. The nipples on the two breasts, do they look alike? Is one looking as if it's being pulled back from behind, and it wasn't like that all the while? These are things you need to look out for. We call them retracted nipples. Are there sores in and around the breast? These are the things that you need to look out for as a woman. But if you've not been in the habit of doing self-breast examination, which we have conversed and advised that all women should be doing that at a particular time in their menstrual cycle. Usually it is preferable to have it done when a woman has finished her menses, because during that time, the breast is usually less bulky.
Okay, doctor, I think we'll go on this short break. We'll be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
Healthy cells are the basic building blocks of all tissue and organs in the body. But when cell DNA, the cell's wiring, is damaged, mutated cells begin to rapidly reproduce without following the pre-wired plan. Aggressive cell growth can form a tumor or mass of tissue that, like each individual cell, does not function as originally intended. These abnormal cells, or group of cells, can progress into the disease known as cancer. Breast cancer usually begins either where the milk is being produced, the lobules, or in the milk ducts. Lobular carcinoma in situ, LCIS, is a precancerous condition that forms and is contained in the lobules. Invasive lobular carcinoma is a type of cancer that develops and breaks through the lobules, with the potential to spread to other areas of the body. Ductal carcinoma in situ, DCIS, is a type of cancer that forms in the milk ducts and is considered non-invasive because it has not spread to any surrounding tissue. If the cancer has spread beyond the milk ducts, it is known as ductal carcinoma. Less frequently, breast cancer can originate in the stromal tissue, the fatty and fibrous connective tissue of the breast. Treating breast cancer as soon as it's discovered is very important. If left untreated, the cancer cells may invade healthy breast tissue or lymph nodes. Once in the lymph system, cancer can spread more easily to other parts of the body.
Okay, we welcome you back to Health Matter, and we still deal on the topic of discussion. So we hand over the floor to the doctor. Okay, you can pick up, sir.
Yeah, I think you should open the phone lines officially.
All right. Okay. So, guys, feel free to ask doctor any question on top of what they discussed today. Breast cancer. You guys can see that for yourself. 08105434984. And of course, 08173147589. Anything we know, understand. Now the best time for you be this to ask him. I'm sure he's ready to answer, doctor.
Yeah, thank you very much. And let me start with Chief's opening question. Okay, so now the question was that he was part of a rescue team that attended to somebody who, a non-hypertensive patient who went into crisis and of course was rushed to a hospital. So he was asking, could it have been possible, keeping in mind that we discussed a whole lot of things when we treated heart attack. And then one of the things we thought was that if you think someone is having a heart attack, you can actually give the person baby aspirin. Okay, so his question was, in such a situation when the woman can actually not or will not be able or might not be able to take anything, due to her consciousness level, is it still possible for that to be done? Of course, my answer is no. You don't give anything to a patient who is not anybody who is not fully conscious. Okay, so if you do, it could get into the wrong aspect of the body, and of course, the person could have a condition known as aspiration pneumonitis. So people who suffer stroke, who are unconscious as a result of accident or any other medical condition, you shouldn't feed them, even if they have stayed for many days without food. What you should do, hurry up as fast as possible to get this person to the nearest hospital. Okay, so that's what you can do. When you get to the hospital, the doctors know what to do. Permit me to also say that it's a pity this patient did not survive. My condolences to her family. They may be watching the program.
Yeah, sure.
Okay, so back to our topic for today. Okay, so epidemiology of breast cancer. According to WHO, breast cancer is the most common cancer among women worldwide. 1 in every 8 person we have breast cancer, invasive breast cancer in the United States of America. Each year, it is estimated that about 270 patients or females, women in the US will be diagnosed with breast cancer. And out of this figure, 45,500 may not survive. Now, breast cancer can also occur in the males, but it's predominant in the females. Okay? In the males, an estimated 2,470 males are diagnosed with breast cancer in the US. And out of those figures, about 460 may not be able to survive the ordeal. Also, on the average, every 2 minutes, a woman is diagnosed with breast cancer. And every 13 minutes, a woman dies of breast cancer in the United States. Suffice also to point out that a lot of people are surviving cancers at the moment in our age and time. Over 3.3 million people, cancer survivors, are living in the US. And the key to surviving breast cancer is, of course, early detection. And that is what this program is all about. The sensitization, the awareness are now beyond what it used to be. And of course, the population stands to benefit from that. Also, I'd like us to look at the causes of cancer, of breast cancer, as well as risk factors. Breast cancer has no known cause, but researchers have identified a number of risk factors that have been implicated in breast cancer. And of course, this group of risk factors are the ones we refer to as modifiable risk factors, the ones we have power that we can to control and that we can change things about, and the non-modifiable risk factors. Now, for the modifiable risk factors, if you're overweight, you need to start working on your weight. As a woman, it has been documented as a risk factor for breast cancer. If you're in the habit of eating junk food, unhealthy foods, this is time to stop. You need to be careful with the food you eat. You can be exposing yourself to breast cancer by eating junk food. Lack of exercise. Do you live sedentary lifestyle, chauffeur-driven to the office, back to the house, and you don't have time to exercise? It's advised that you should be doing at least 30 minutes of exercise within 5 days in every 1 week. If you drink plenty of alcohol, it's time to stop. As a woman, also as a man, it can actually predispose one to breast cancer. What about smoking?
Okay. Salahuddin, good morning.
So, good morning, Chief Olododo.
How are you doing, Salahuddin?
I'm fine.
Yeah, the doctor is here. Go ahead with your question, sir.
Yes, first of all, I want to thank the doctor for the series of lectures given to us on our Matta.
Thank you.
Thank you, sir.
My question is based on the past lectures given to us. I want to know whether the size of penis can determine to impregnate a woman. What I'm trying to say that is, if someone has small size of penis, can he make it not to impregnate a woman?
Okay, thank you very much. I think I got your question. Okay, now the size of a man's phallus does not stand on the way of fertility. It hasn't been documented as a cause of infertility. As a matter of fact, artificial inseminations are done, and of course, women can get pregnant from that. In doing artificial insemination, just like the name sounded, artificial, you're not employing the use of phallus here, human phallus here. Okay, so you're using an instrument to introduce the semen or the sperm into the reproductive system of the female. So what needs to be done is to ensure that the semen is introduced into the chamber. Such a person will get pregnant. So the size of the phallus is not a cause of infertility. It's not a documented cause of infertility. Thank you very much, Salahuddin from Jos. Another modifiable risk factor, back to breast cancer risk factors, is prolonged use of hormonal contraceptives. A lot of women who have gone beyond the age of menopause, they still want to look as young as slim as. And of course, by so doing, some of them will resort to taking some of these hormonal contraceptives to make them look young. If you're doing so, keep in mind that if you use it for a prolonged period of time, it can actually predispose you to breast cancer.
What about family planning?
Yes, some form of family planning. It's not family planning. Family planning per se is not a risk factor, okay, for any form of cancer. But what has been said is
Concerning.
yes.
What I'm asking is because of your obesity you mentioned. I've seen some people that had family planning, and as a result, it's still
Not directly. That's what I'm trying to. Thank you very much for that question. Now, some family planning methods, of course, don't forget that hormonal components or hormonal drugs, they can make one gain weight. And of course, if that happens, you're indirectly increasing your risk of having breast cancer. So indirectly, the answer should be yes. Lydia.
Good morning, Lydia.
Good morning.
How are you doing?
I'm fine.
Okay, the doctor is here. Go ahead with your question, please.
Okay. Hello.
Hello. Good morning, Lydia.
Good morning, sir.
Yeah, thank you.
Fine.
Okay, so let's have your question,
Good morning,
Lydia.
doctor.
Lydia,
The
turn
doctor
down
is
your
here. Turn down the
volume so
volume,
that he
please.
can hear you well.
Please, I want to ask, what is the main cause for the breast cancer?
Thank you very much, Lydia. Now, that's what we are dealing with. There's no major or main cause of breast cancer, okay? What researchers have told us is that breast cancer does not have any identifiable cause, okay? But there are risk factors that can predispose a woman or a man to having breast cancer, okay? So, and those are the things that we have listed. We have listed the modifiable risk factors, the one that you have a say as an individual. For instance, you can determine that if I'm overweight, I have to make conscious effort to shed weight so that at least I can have a good body mass index, BMI. And of course, that will help you to stay healthy. You can decide to stop smoking. You can decide to quit alcohol if you take it in excessively or in excessive proportion. Those are modifiable risk factors. You have a power to change things along those lines. However, there are some of them that you do not have the power or a say in what happens. And those set of risk factors are called non-modifiable risk factors of breast cancer. And of course, one of them is age. You can't stop yourself from aging. Okay, it's a natural phenomenon. Man will ultimately grow old and die. So we can't do anything about the fact that we age as the year goes by. Okay? Number 2 is female gender. We've reeled out a number of statistics that shows that females are about 80 to 100 times more likely to have cancers than males. Okay? Another non-modifiable risk factor is family history of breast cancer.
Hereditary.
Okay, so if your family, if you have 1 or 2 people who may have suffered breast cancer in your family, you have an increased chance of having this disease. Ahmed.
Good morning, sir.
Yeah.
How are you there, Ahmed?
Yeah, good morning.
How are you there, please?
I did fine.
Okay, so the doctor is here. Go ahead.
Okay. Yeah. Good morning,
Yeah.
Chief Ulududu.
How are you there, Ahmed?
I did fine. I'm fine.
Okay, the doctor is here. Please go ahead.
Yeah, please. I want to ask the doctor that if one has the good morning, doctor.
Good morning, my brother. Go ahead. We can hear you, Ahmed.
Yeah, please. If one has the breast cancer, how would one detect it in early stage, please?
Thank you very much, Ahmed. I'm happy you've had that, not just the females, so the males too can have breast cancers, okay, but not in the same proportion with the females. Now, what you need to know, if you're a woman, how you can detect breast cancer, if you have one, is for you to get accustomed with what the normal is in your breast. So that should you see an abnormal situation, it will be a lot easier for you to pick it out before you can go see your doctor for further examination. As a matter of fact, it's advised that apart from doing monthly self-breast examination that every female should be doing from the age of 20, okay? Apart from doing that, females too should develop the habit of going to see their doctor once in a year, once in 2 years, or once in 3 years for clinical breast examination by the doctor, okay? Now, the signs that you can see if you're a woman, we have mentioned some of them
sorry,
before.
doctor, there's a question that actually pops to mind. The size of bra that women uses, most especially ladies these days that actually want to use small and firm bras, maybe to pop up the breast or to make it juicier for the eye. Can the size of bra lead to breast cancer when it's over firm?
No, sir. Sometimes in medical practice, we advise women to wear an undersized bra. So I was laughing because of that. Sometimes we ask them to. Ahmed from Lagos.
Ahmed, good morning.
Yeah, good morning.
How are you there?
Fine. I called earlier on.
Okay, the
We are
same
trying to
Ahmed.
tackle your question, sir.
Yeah, I have 2 questions to ask.
Okay.
Yeah, morning. I was what I just said earlier on, but the line cut off.
Can you turn down your volume?
Go ahead, we can hear you.
Turn it down. Now, waiting at the issue we been get the first time, it has reduce the volume so that we'll feel hear you well and you feel hear us back.
Hopefully, you'll be able to call us back. Okay, so back to, I'll come to your question, sir. Okay. Let me deal with that of Ahmed because he's calling for the second time. So there are changes that when a woman sees in her breast, she should be worried. And one of the first things you need to do as a woman is to get used to what the normal is. I've said that before. If you have color changes in your breast, is a source of concern. If your breast is dimpling or looking puckered, or if you're having an undue pain on your breast, is a source of concern.
Daniel, good morning.
Yeah, good morning.
How are you doing?
Good morning, Daniel.
This is Daniel calling from Bayelsa State, Ogbia local government, Oshogidi community.
Thank you very much. How is Bayelsa today?
No problem. We are all fine. Is it true that shocking a woman's breast helps the breast cancer?
Help spread the breast cancer?
No, to reduce.
Okay, to reduce.
There was a time that a doctor said that for a man to shock his wife's breast, that helps for breast cancer.
Okay. Thank you. I get your question. I get where you're going to, sir. Now, his question is actually the suckling. Is it one of the things that can prevent
Somebody asked
breast
the
cancer?
same question last week.
Now, my answer to that is that the number of studies that have actually postulated that, but it's not yet confirmed. So I can't tell you with certainty that yes, it can prevent breast cancer. Okay, and at the same time, I wouldn't wave it aside. Okay, because of course I know that other medical experts are equally watching what we are doing here. Okay, so it's neither here nor there. Okay, so now let me deal with Chief's question, whether the undersized bra, if a woman wears it for some time, if it could cause breast cancer? The answer is no, but it can cause a problem that is known as traumatic fat necrosis, which can actually mimic breast cancer. It could show as a lump and it could become painful. Okay, so when a woman has a painful breast lump, it could be as a result of traumatic experience to that breast. And last week, I think we mentioned that women who strap themselves so tightly with seat belts, you may inadvertently injure the tissue or the substance of your breast without knowing. Over time, you could have a lump there, and such a person can actually think he or she that she has a cancer in that aspect of the body. No, it could be traumatic fat necrosis. Okay, so that's what it can cause. We are still on the non-modifiable risk factors of breast cancer. Early onset of periods. When females see their periods before the age of 12, what happens is that one of the hormones in the human body, okay, let me take the two at the same time. Early onset of periods as well as late menopause, okay, because the same explanation will take care of the two. When a woman begins to see her period earlier than she should, before the age of 12, and also when a woman attains her menopause later than 55 years, some researchers say 50 to 55 years. What it means is that the woman such a person has an overstretched longer period of time to deal with the deleterious effects of a particular hormone in the body, which is estrogen. Now, if you're exposed to this estrogen for a long period of time, it has some disadvantages, and one of which is it can predispose one to breast cancer. Also along that same line, if a woman does not become pregnant in her lifetime, she also has an increased risk of having breast cancer on account of this similar reason. Because when you have pregnancy in between, it interrupts the bad effects of estrogen hormone in the human body. Okay, so it's helpful in some ways. Joshua from FCT. Joshua, good morning.
Hello, good morning, sir.
Good morning,
Yeah, good
Joshua.
morning,
How
my
you
brother.
doing?
I'm fine, Chief. Good morning.
Good morning, sir. How FCT?
Well, we thank God.
Okay, to your question, sir.
Yeah, I have a question for you, doctor.
Please go ahead, sir.
And I will do it in two ways. I want to stand in for somebody which is suspecting a breast lump, and I want to also make an inquiry from you as well. Number one inquiry is this. This breast cancer, is this hereditary, or that's in passing on from progeny or from one, all this hereditary stuff? And
Number two.
what are the ways? What are the ways of avoiding it, apart from the hereditary aspect of acquiring the breast cancer? And secondly, all these cosmetics caused breast cancer. All these hard cosmetic bleaching, hydroquinone, whatever. I don't know if they cause breast cancer. Then I want to stand for somebody in which I'm suspecting a breast lump, because actually she's my friend, and I noticed that there is a very hard core on the surface of the breast, which I'm not a doctor, but I suspect it should be a breast lump. And but although just one aspect very strong, which way forward? Is it like due for like maybe cancer operation or removal or chemotherapy? I don't know what's the way forward to do.
Okay, thank you very much
for those 3 in 1 questions. So let me deal with the first one. He actually read my mind. Okay, now there are some genes that are associated with cancer. We call them BRCA1 and BRCA2 genes that are associated with not just breast cancer, but some other cancers in the body. Such genes can be transferred from parents to their offsprings. Okay, so the idea of the notion of hereditary is confirmed. Okay, so cancer runs in some families. Okay. Now, talking about what you can do in terms of prevention, those should be along the line of non-modifiable risk factors. Those ones that you have a say. Okay. We mentioned some of them. You need to stop smoking. You need to alcohol and all whatnot. I'm sorry, that is how far we can go for today.
From there
Okay. Thank you very much.
We'll start from there next week.